Hi, everyone. We're letting people into the town hall right now, and so we'll just give this a couple minutes before we get started. And while we're waiting, we're going to start running a short poll. We'll leave it up for a few minutes as more people join us. Okay, well, we're going to go ahead and get started. We know it's 5 o'clock on Tuesday evening, and we're just thrilled to have everyone here with us today and to have this partnership with California Indian Nations College, Riverside-San Bernardino Indian County Indian Health, UC Riverside School of Medicine, and the Center for Health Disparities. And then the project is overall supported by the Stop COVID-19 California, which is part of the National Institutes of Health Community Alliance program. And so tonight we're really excited to have everyone here. We know that COVID, well, it's been getting better. More people are vaccinated, people are masking. There's still a lot of questions out there about the vaccines, about booster shots, about our kids getting vaccinated. And so we wanted to take this time to ask the questions and share and learn from some of our local experts. And so before we begin, I'd like to start with the land acknowledgement. This is UCR's land acknowledgement. It was created in consultation with our Native American faculty and the Chancellor's Native American Advisory Board. So we at UCR would like to respectfully acknowledge and recognize our responsibility to the original and current caretakers of this land, water, and air, the Cahuilla, Tongva, Luiseño, and Serrano peoples, and all of their ancestors and descendants, past, present, and future. Today, this meeting place is home to many Indigenous peoples from all over the world, including UCR faculty, students, and staff, and we are grateful to have the opportunity to live and work on these homelands. And I'd also like to acknowledge that I am currently living on the lands of the Tongva and Hachiman peoples. So again, welcome. And at this time, I'm going to turn it over to our amazing CINC students, Gabriela, Armenta, and Alfonso Taboada.
Thank you very much, Dr. McMullen. My name is Alfonso Taboada. I am currently enrolled at CINC. I'm pursuing sociology as my major. So we were supposed to discuss a bit about what COVID means to us. COVID really shaped, like, has shaped a few aspects of my life, as I recently lost my grandfather after he contracted COVID. So it has definitely shaken up my family, and it is something that could have been could have been prevented and could have been uh, better treated, but it is something that sometimes we either neglect doing, forget to do, or are too scared to do. So I'm hoping we can all just learn a bit today about it and continue going, hopefully putting up a good fight. Um, go for it, Gabriela.
Hi, good afternoon, everyone. My name is Gabriela Armenta, and I am a political science major at California Indian Nations College. I'm happy to be here. And COVID has definitely impacted my life. I'm actually a COVID survivor. I contracted COVID last year in June, and I had it for, at least to my knowledge, for about 40 days. And I went through and survived through maybe like 12 of the most severe symptoms. Like I said, it did change my life because I am still battling some of those post COVID symptoms, including PTSD. And I'm also a recipient of the vaccine. So I am just happy to be here to be a part of this project and just keep informing the community. Thank you.
Uh, we would like to also introduce um, two our two presenters, or our people who are going to be our two panelists, Dr. David Lowe and Dr. Ramon Ferra. A bit about Dr. Lowe is he is the Senior Associate Dean for Research at the University of California, Riverside School of Medicine and a distinguished professor in the Division of Biomedical Science. He received both his medical degree and Ph.D. from the University of Pennsylvania. He's the director of the Center of Health Disparities Research, as well as the Breath Center, Breath being Bridge Regional Ecology, Aerosols Toxin, and Health Effects.
And then also we have with us Dr. Ramon Ferra. He is a clinical service director for Riverside-San Bernardino Indian Health Inc. Dr. Ferra was born in Cuba, and Dr. Ferra immigrated to the US in 1961. He and his family moved to Santa Ana, California in 1963 and grew up there. He attended UC Irvine for his bachelor's degree in biological science and then attended UC Irvine School of Medicine. His last duties before joining RSBCIHI was medical director of the OBGYN services at Mount Sinai Medical Center in Miami, Florida. Dr. Ferra has performed thousands of deliveries and gynecological surgical procedures. He has trained medical students and residents in 4 major universities across the country. Dr. Ferra is a board certified in OBGYN and is a current member of the American College of Obstetrics and Gynecology. Welcome.
So welcome, our presenters. Did you want to go ahead and share a little bit about your work, and then we can open up the floor for questions? Just go right into questions from our audience. Dr. Lowe, did you want to go ahead and go first? And then...
Oh, well, we are, the Center for Health Disparities Research is especially interested in a lot of supporting the project to understand the causes of health disparities in the community, and especially in impacted communities that are underserved, including the indigenous communities, as well as the Latino and Black communities. And one of the projects that we're working on is focusing on the impact of air quality near the Salton Sea and its role in the high incidence of childhood asthma. So those are theirs we're particularly focusing on.
Great. Dr. Ferra?
So as you heard, I practiced obstetrics and gynecology for over 32 years and decided to move back to California and pursue less clinical and more administrative work. I became the clinical services director at RSBCIHI on January 22nd of 2018. And then who knew COVID was going to hit? So our entire clinic system, of which there are 8 clinics throughout the 2 counties, pivoted towards a very aggressive approach to diagnosing, treating, and eventually vaccinating against COVID-19. To date, we've had a peak of about 23% positivity rate. We're currently at around 9 to 10%. There are peaks and valleys. We're no longer in those huge surges. But we're at peaks and valleys, and any particular week we could be at 3% positivity, and the next week be at 13 or 14% positivity. The majority of the new cases, as you know, are the Delta variant, and mostly in children. So vaccinating children is going to be the key to this, I think, going forward, because that's where the biggest population of congregation in schools, et cetera. To date, we have administered a little over 18,000 vaccines. We have all 3 available. We have the Pfizer, the Moderna, the Johnson & Johnson, and we are currently giving the booster shots as well as the 3rd dose for immunocompromised patients. And hopefully by next week, we will be starting the 5 to 11-year-old children.
So we have some questions that we'd like to share with you too, if you're willing to answer.
Of course.
So the first question is, how safe is the vaccine for young children?
So I'll take a stab at that, and hopefully Dr. Lowe will correct me. The Pfizer company has been very aggressive at doing large studies with this population 5 to 11 years old, and it appears to be as safe as any other vaccine.
So maybe I can put this in a little bit of context. So for anything that goes into people's bodies, the clinical trials that are done are usually involve thousands of individuals just for testing for safety as well as effectiveness. And for example, the Pfizer vaccine was tested in hundreds of thousands of adults and now has gone into a couple billion people. And so when the studies were done on children, the safety of the vaccine has been very well established. And so several thousand children have now been tested both for safety and effectiveness. And it turns out that in children, it is every bit as effective in preventing serious disease, hospitalization, and death, somewhere over 90%. So it is definitely extremely safe. And as I said, in terms of people who have been tested and studied closely during these clinical trials, it's really hundreds of thousands, but then of course, hundreds of millions and a couple billion have been actually receiving the shots without with extremely low complications or side effects, and that is far safer than, far more tested than most drugs that are approved by the FDA. So we have a lot of confidence in the safety and effectiveness of these vaccines in children.
Also, the side effects appear to be mild, and it's the risks to the vaccine clearly outweigh the risks of getting COVID. In other words, you're better off getting the vaccine.
I realize that sometimes people are distracted by whether or not the side effects are serious, but we do know that hundreds of children have died when they've actually contracted the virus infection, and hundreds and thousands have been hospitalized. So in terms of your kind of balance, the risk and benefit, you're far more safe having the vaccine in terms of the relative risk.
I agree.
Thank you. So we have another question. Once patients have been vaccinated and have had COVID, what are the chances of being reinfected?
So the data put out by the CDC and the FDA has that number hovering right around 1% of breakthrough cases, what they call breakthrough cases after having been vaccinated. And those cases have been mild. And to my knowledge, they have not led to any deaths or serious hospitalizations.
Yeah, I don't think I have much to add there. I think one of the important aspects of the vaccination, whether it's following some actual infection or not, is that it also has a really important impact on preventing spread. So that even if you have a very low existing risk of a breakthrough infection, there's almost an almost entirely non-existent chance that you're going to pass it along to somebody else.
And we have another question about travel. How do you feel about travel? So which of the following types of transportation do you feel comfortable using at this time? Airplanes, trains, buses, how do you feel about that? Or even ride shares like Lyft and Uber or taxis?
So my answer to that would be that they are all safe as long as you've been vaccinated.
Yeah, I agree with that. In fact, when you look at things like how airplanes, you think you're in a closed space for hours, but in terms of the amount of air, filtered air that goes to the cabin of an airplane, it's actually really very clean and very safe, even compared to, say, being in a closed room.
I just traveled with two other colleagues to Milwaukee, Wisconsin for 3 days in an airplane, of course. And of course, the airlines require that you wear a mask at all times during your time in the airport and in the airplane, in the aircraft. All three of us were vaccinated and all three of us sat together. So we kind of congregated our little space. But the filtered air in airplanes is ultra filtered, so should be safe.
Thank you. So we do have a question here on the poll, and it also says, are there any long-term studies of Moderna vaccines, and what are the possible chronic side effects of the Moderna vaccine? Ferra asks.
Quick correction, it's the mRNA vaccines.
Thank you.
I suppose I have a quick answer to that. It's interesting when people are asking about long-term effects when the vaccines have only been going into people for let me think, about a year. So it's really hard to really get longer term kinds of questions. But there is a lot of data that from people who have been studied after in the initial studies on the vaccines, and there really have been I have not seen anything in terms of late complications or side effects that suggest any kinds of long-term effects.
I agree.
Thank you.
Can I ask a follow-up question? Sorry to that.
It-
Sorry to interrupt. Because it just makes me think, because we hear so much about, long-term effects. And so what is your sense, or what are some things that we might be able to say to people when they raise those concerns about the vaccines? And
Well, the vaccine itself is not the virus. It's portions of the virus. It's a dead entity. It gets into the cell, and here's where I'm going to punt to Dr. Lowe, but it gets into the cell and produces a change to be able to create antibodies towards a core part of the virus. And that's why it seems like the one vaccine is attacking with great success multiple variants. These viruses can mutate very quickly, and so the mRNA is attacking the structure of the virus and keeps going. The vaccine itself, that component, the mRNA, disintegrates within a few hours to days. So that's nothing that is lingering in your body. It's just creating an effect in the white cells to produce antibodies towards the virus.
That's a great description of how the vaccines work. The only thing that really lingers is your immune response. And I would compare that to, the mechanism of immunity that these vaccines induce is almost identical to the kind of immune response you get from the annual flu shot or the pneumonia shot and things like that. And so the long-term immunity you get is similar. In terms of long-term impact, remember, for all the other vaccines that we get, like the tetanus shot we get every 10 years or the flu shot we get every year, there's some, slight decline in the potency of the immune response over time. But that's why we get our annual flu shot, or at least I hope you get your annual flu shot. For those same reasons, that we're not so concerned really about any side effects. We're really concerned that you keep up the immunity to protect you against the next season's flu.
Thank you. So here we do have some more questions. Why do we need a booster shot?
Well, maybe I'll just, it's following up on what I was just saying a minute ago, is that over time, your immune response, has its own kind of memory. There are many different components of your immune response. The one that produces the antibodies, but there's also this T cell response that provides a long-term memory. But even that can decline over time. And so the reason you have booster shots is to basically kick up the immune memory. And one analogy that I've used in the past is like when you go to class and you sometimes people are different, so you may remember exactly what the lecturer said, and you're ready for that exam, right? At the end of the term, but not everybody remembers everything perfectly, and so that the booster shot is like that refresher, that kind of reminder, or that's why you study. So you need the immune system to get that refresher and to study so that it's ready when that infection comes along.
I would just add to that take a look at the flu virus. The flu virus mutates so quickly that year after year, there are different variants. And so they have to pattern the flu vaccine against the most frequent variants seen in the population. So that's why we get a flu shot every year. How fast is the COVID virus mutating, and how often are we going to see a booster? I'm anticipating that this will be like a flu shot, that eventually we'll get a periodic shot, whether that be once every 6 months or once every year or once every 10 years, like the tetanus vaccine. It stands to, we need to wait to see how that pattern develops.
There's actually clinical trials going on right now where they're mixing the flu and COVID vaccines, and so far they're just as safe as the individual vaccines, and that would certainly make it a lot more convenient to simply get your regular annual shot and everything's covered at the same time.
So another question.
Oh, I don't, Gabriela, did you mute?
I'll take this
Do you
question.
want to take the question
Yeah,
from me?
no
Okay,
worries.
thanks.
So a lot of naysayers are afraid that something bad will happen to those who take the vaccine in the coming months and years. What do you say to people with those concerns? And what is the worst thing that could happen to people who have taken the vaccine over the last year?
So there have been a couple of serious side effects in very small groups. The Johnson & Johnson, for example, there was a group of women, I think 35 to 49, don't quote me on that, but that's around the age group, where they had a very serious blood clot in the brain. And there were several deaths from that. I don't recall, there have been some serious side effects from Pfizer and Moderna, such as Bell's palsy, but that's temporary. Guillain-Barré syndrome, that's also temporary. There have been seriously cases where you got the first dose and you got COVID waiting for your second dose, and people died of the COVID waiting for the second dose. So that's a partial answer. The rest of the answer, I think, is going to need to wait over time. We know that the virus has killed 760,000 people in the United States, that across the world, it has killed, several million. So we know what the virus does. It can be deadly and it can be serious. And for one of our moderators here, she's a long hauler, as they call it. She's got chronic symptoms because of the COVID virus. We're going to have to wait, I think, to see what the long-term effects of the vaccine is, but we already know how serious it is to get COVID.
And I think it's important to note that those cases where there have been some serious side effects, the numbers are somewhere in the range of 1 in a million vaccinated. So your chance of having a serious side effect is rare, and so doctors are aware to look out for some of those symptoms. So that's certainly important to know. And again, as Dr. Ferra pointed out, the risk of not getting vaccinated and catching the virus, the risk of having serious disease or death is far, far higher.
Thank you. So this is a question that's coming from me. So like I mentioned before, right, I went through COVID. And what do you say to folks that are still very skeptical? Because in my case, I consider myself pretty healthy before I got the virus. I was exercising, I was hiking, I was doing everything that I could. I remember at the time to lose weight in a safe and healthy manner, and I got really sick. So, what do you say to folks that say, okay, see, even people that have no underlying conditions, and I had none, can still get sick? This is, the vaccine is not going to work. It's not going to help you.
So people with no underlying conditions have died from COVID, definitely. Very healthy young people have died from COVID. Children have died from COVID. So I go back to my first comment, we know what the virus can do. And any way that we can prevent an infection from COVID, and the best way we know how currently is the vaccination, and the more people that get vaccinated, the better. There's a question in the chat about how you counsel parents who are anti-vaxxers for their children. That's a hard one. I mean, we all care and love our children. We all want the best for them. But when you think about it, our children go to school and need to have the MMR vaccine on board because we don't want that spread. They have the polio vaccine because we don't want that bad disease coming back. They have the adults, we get the Tdap because if we get sick with whooping cough, we could, transmit it to our grandchildren. So there are plenty of good reasons to get the vaccine and no credible data regarding the harm of vaccines when it comes to children. So I guess, I'm a parent of 5 children, and if they were of that age group, I would be encouraging them to get vaccinated. My grandchildren who are above 12 have been vaccinated, and we have a group of grandchildren that are just coming up. One is 5 or 6 years old, and they're about two years apart. So as they get there, I'm going to encourage for them to get vaccinated. And one last thing, the majority of the new cases, well over 90%, are in unvaccinated patients, and many of them are children, a significant proportion.
Yeah. I think that I agree that it's a difficult thing. My brother's in internal medicine and spent quite a lot of time discussing with his patients, what their concerns are. And different people may have different kinds of concerns. And I think one of the challenges is to really discuss with parents or individuals, if they have concerns, what really are the specific concerns that they have? Because these are conversations that we can have, and we can actually address those kinds of questions. Because if it's just kind of non-specific, I'm nervous and things like that, then I'd really want to hear what is the worry, what is the concern, so that maybe we can have the conversation and try to figure out, do we have those answers available to you to really help you think about what you want to accomplish and what the vaccine may be able to do for you to help protect you, your kids, your grandparents, things like that.
Thank you. So we do have a few more. So someone put, I have a family living overseas and they started administering some vaccines that are brands that aren't Moderna, Pfizer, and J&J. Is it possible that we can explain more, or that you could explain more about the other vaccines and how they could impact the globe in the COVID-19 cases?
There's a vaccine that was developed in China. I think it's based on an adenovirus. It's an engineered virus. There was one in Russia, also an engineered virus. The AstraZeneca is also an engineered adenovirus. They all work pretty much the same way. There's another one in clinical trials where it's basically a manufactured protein that is not so different from the kind of vaccines we use for hepatitis, for example. All of them basically work the same way. They either convince your own cells to produce the protein that your immune system is going to respond to, or they simply give you the protein that your immune system is going to respond to. So they all pretty much work in the same way. They induce the same kind of antibody response. They induce the same kind of cellular T-cell response. They show slightly different degrees of protection. They are all pretty good in terms of, I'm sorry, there's another one that was developed in India. I'm sorry, I forgot about that one too. So just for comparison, you know, if you go to the drugstore, you have one of 4 different flu shots to choose from. So there are different manufacturers, there are different types of vaccines to choose from, but they all pretty much work the same way in terms of how they induce an immune response and how they protect you from infection. And there are going to be some differences in terms of how well they work, and sometimes in terms of what percentage of people are protected. Although sometimes that's dependent on your environment, your circumstances, what country you're in terms of how well that vaccine will produce an immune response, because it can be, for example, that the same vaccine in one population can be highly effective because of either the healthcare system, nutrition, things like that. Whereas in a different community or different setting, it may have different degree of protection. But again, they all work on the same principles of triggering a protective, an antibody response that will neutralize the virus, as well as a protective T cell response.
Thank you. So another question is, why are people with the vaccine still getting COVID and passing away as well?
So once again, the rate of getting COVID in the United States, forget about the United States, let's talk about our community, okay? Our Riverside and San Bernardino County communities. We peaked at getting COVID a positive rate of 23%. That means 23 out of every 100 people got COVID. Out of those, there was a 5% death rate, as high as 5%. In some places in the United States, even higher. I'll point to New York City, where they had that very, very bad time. The rate of getting COVID after vaccination, or what they call a breakthrough case, is about 1%. And out of those, I couldn't tell you how many people died, because there have been so few deaths, so few hospitalizations. If they get COVID, it's mild.
One of the important things to remember is that one reason we emphasize having everybody possible vaccinated is because there's a significant number of people in the community who are not, who don't have a strong enough immune system where they won't be able to produce their own protection in their own immune response, even if you give them, you know, multiple doses of the vaccine. So people who are cancer patients, the chemotherapy basically wipes out their immune system. People can have a, you know, immunosuppressed system, even from various chronic diseases, as well as things, again, cancer and so on. So the problem is that if those people are immunosuppressed, even if they get the vaccine, they may not be able to generate a protective immunity. And so if the community still allows the virus to circulate, those immunocompromised, immunosuppressed people can still get the virus and still die from it, because they're unable to respond and recover from those virus infections. And so that's one of the reasons we do emphasize everybody getting vaccinated. So there's so much protection in the community at large that it minimizes the chance of those immunocompromised people from actually getting infected and dying.
So a good example is General Colin Powell, who just passed away. He was in his 80s. He was fully vaccinated. He got COVID and died from COVID illness, but he had survived one form of cancer, prostate cancer, and was currently being treated for multiple myeloma, which is a blood cancer. So he was majorly immunocompromised, and despite the vaccine, he died of COVID. But those are expected rare cases.
Right. Thank you again. And then another question in the chat is, I currently live in the border. I've got lots of family and friends in Mexico, and I see lots of deaths still in people that are fully vaccinated with and without underlying diseases. Why do you think that is? Why do you think that's happening? Is Mexico receiving low quality vaccines? Is the biological agent not working?
So I'm going to punt to Dr. Lowe here, but my understanding is that the percentage of the Mexican population that is getting immunized is incredibly lower, much lower than the United States.
Yeah, I would say that that is certainly one possibility. As I said, there are other factors that can lead to people being immunocompromised. It could be things like nutrition, it could be chronic disease, things like that. But we don't really have the benefit of real accurate information on that. So I really hesitate to speak in too much detail, not knowing really whether this is just rumor or actual numbers.
And you know that they just opened up the borders to fully vaccinated people from Mexico. So the back and forth to and from Mexico is now open. Same thing as Canada, same thing as Europe, but you have to be fully vaccinated.
Thank you. So we have another one here. Since my husband got the COVID shot, he has been more tired and not feeling well for the past 3 months. Have you heard this?
I can tell you that we've given over 18,000 vaccine doses. The reactions have been variable, individual. The majority are a sore arm and a little bit of fatigue and body aches the next day. Some people did get fevers. Some people did get a cough. The longest that we heard in terms of the population that we have been vaccinating, symptoms have only the majority last for 1 to 2 days. And there have been a few that have lasted 7 to 10 days, but nothing to my knowledge exceeding that timeline.
Okay, so one more question here. Why do we have to get, and I know we talked about the booster shots, but that seems to be the most pressing question right now for everybody. But why do we have to get a booster shot after receiving the COVID vaccine? Especially, and I'm gonna add to that, what about if you, for those folks that have had the virus, got the vaccine, is it still necessary to get the booster shot? Because I figure, hey, we have antibodies. Do I still need it?
So we don't know what the long-term effect of having COVID plus the vaccine over a lifetime will be. We have to wait that time to be able to assess that question. But we do know that with any vaccine, your immunity wanes. In other words, it decreases over time. And we don't know what that rate of decline is. The studies that have been presented by Pfizer and Moderna show that after 6 months, you have significantly decreased immunity. And therefore, that's why we recommend the booster. And again, I revert to the flu shot. Why do we do the flu shot every year? It's because the virus mutates so quickly that this year's variant is going to be different from next year's variant. And therefore, we produce a vaccine that attacks the most abundant of those variants. So right now, we're looking at the booster as a third dose to just kick the immune response and make sure that that continues over a longer period of time. And last thing to say is I'm If I were a betting person, I'm going to bet that the COVID vaccine is going to turn out to be like the flu vaccine. Periodically, you get another dose.
I would add that so far we're encouraged by the fact that all of the variants that have come up so far, the vaccines that we have still protect us even from all the new variants. Now, why do the new variants still emerge? As we've seen in California, for example, they're nearly all being spread among the unvaccinated. So, you know, the Delta variant and some new ones that are coming along that are really diseases of the unvaccinated. So yeah, I think we can still expect to see a need for boosters, but again, every disease is going to be slightly different. So we don't get an annual tetanus shot, but we do still expect people to get a tetanus shot every 10 years. So we are going to be learning more about how long the COVID shot is going to protect. But, you know, there's clearly benefit from getting the vaccination. And even in the face of the new variants, we are still protected.
Okay, I believe this is going to be one of our final questions before the raffle. So we have, who is responsible for those who have received the vaccine and have had severe side effects from it? And also they also stated such as passing away from the vaccine or anything long term.
So that's a societal question in the sense that we have a severe illness and the world congregate of scientists, medical specialists, immunologists, infectious disease specialists have come up with the best option for reducing the rate of COVID. And we know that the rate of death from COVID is as high, if not higher, than 5% of people who get it. That's a big number when you think of the fact that we've had 760,000 deaths in the United States from COVID alone. How many deaths have we had from the vaccine, from side effects of the vaccine, in people who may have had underlying conditions? It's not a perfect world, and it's a very sad thing to happen, of course. And whatever we can do to prevent it, we should do to prevent it. And whatever research we need to do to study those cases and see if there's some underlying factor that caused the severe reaction, we have to do our due diligence and do that. But when I say it's a societal problem, it's all of us. We all take responsibility for ourselves and for accepting whatever method we think is going to help us going forward to prevent disease. Dr. Lowe?
We have, again, the FDA, I mean, this country places such a high priority on safety of anything that we inject into our bodies. And so there is the confidence that we have done everything we could to try to protect as many people as possible. And it is sad when there is the rare case where somebody does have serious complications or even death from some unanticipated problem. But again, it's on the understanding that we have done as much as science is capable of figuring out to provide the safest as well as the most effective drugs and vaccines that we have. And so, we simply have to go forward and say that we still have good reason that the next person and the next person still would benefit from the vaccine, even though there are these really extraordinarily rare cases that turn out badly.
Thank you very much. So we're currently going to share some resources if you guys would like to look at them, and give it just a moment. So here we have some links. We have the Department of Public Health and Information. We also have Riverside County information on COVID. We have the Stop COVID-19 California Project, the Riverside/San Bernardino County of Indian Health Incorporated, the NIH Community Engagement Alliance. We also have HDR at UCR COVID-19 Qualitative Report, and we also have California Consortium for Urban Indian Health. If any of you guys would like, we can possibly also share these resources in the chat, or you can message any of the panelists or any of the moderators, and we can share that with you personally.
Can I just add, Alfonso, thank you so much, that the last one, so all of these have great resources for COVID and add to the information that Dr. Ferra and Dr. Lowe shared with you. The HDR qualitative report, that's the report from focus groups that we had done in the community earlier in the year. So it's specifically about Riverside-San Bernardino, and it's information that the Native American, Latinx, Indigenous Latinx, and Black community shared with our research teams. So I just wanted to highlight that as well. Thank you, Alfonso and Gabriela. And thank you, Dr. Ferra and Dr. Lowe. This was really informative and extremely helpful. We appreciate you spending this evening with us. And so I'm going to turn it over to Preeti real quick, who's going to do the raffle. Well, actually, we decided that if there were 5 attendees, that everyone would get a raffle ticket or get a gift certificate. Yeah, so everyone gets a gift certificate. We just need you to decide whether you would prefer an Amazon or a Target gift certificate. So you can go ahead and send that information to Preeti, and we'll send you by email your gift card. And we're just so appreciative of you being here this evening. Like I said, so you get a little bonus and you get a lot of information. And we really hope that this event helps you have the kinds of conversations with your family, with your friends, with your community at large, around continuing to get our vaccines, our booster shots, and which seem to be the highlight of the evening. Everyone's concerned about booster shots right now. So we hope that this is really helpful for you, and that you have a wonderful evening. Did anyone else want to add last words for us?
These are excellent questions. I think they really cover a lot of the concerns people have, but also really address a lot of the issues. I think Dr. Ferra pointed out the reason the society really gathers all its resources for these kind of initiatives is for that kind of care about our community.
I would just like to wish everyone a safe and healthy holiday season.
Thank you, Dr. Ferra.
Hi, Julia and everybody. This is Sherry Salgado. Sorry I was late, but I couldn't get the link and I missed a lot of it. And I know it was important stuff that you guys talked about. So hopefully we can do this again, and hopefully we can get more people on, because I know the big talk right now is about the booster, but I got my vaccines, and so I'm going to do my booster soon. You know, I did the flu shot and now I waited the 2 weeks or whatever it was. So now I'm gonna get ready to do the booster. So, so I'll be fully vaccinated. So, you know, I hopefully people that are listening and that, you know, came here, that hopefully if you haven't, I hope you decide to, or, you know, talk your family into it, because it's really important and it keeps us all safe. You know, we've all lost people from it, you know, and until we get this vaccine and everybody vaccinated, we're still going to keep losing them, you know, and that's a sad part, you know. I said, I hate to see that in my community, in anybody's community. So I think we really, really need to put that word out there. And I really appreciate doctors coming on tonight and talking, and really appreciate you guys, both of you coming on. Thank you.
Yeah, thank you so much, Sherry. Do you mind introducing yourself so people know who you are? Oh, no.
First, I'm from the Queer Band of Indians, and I'm sit on the board for Riverside-San Bernardino Indian Health, and I'm the board president.
Yeah.
Okay.
Thank you.
Mhm.
It just adds, you're modeling the kind of thing that we want to see people doing. So
Yeah, really, I do. It's important.
yeah. Thank you so much.
Mhm.
Yeah, so thank you, everyone. And you'll be seeing more of us. We'll have materials. I think we'll be at an event at Kauai in a few weeks, and we're not going away. So
Right.
yeah, we will keep on whispering in your
word out. Yeah.
yeah. So we wish you a lovely evening. And as Dr. Ferra said, as the holidays come up, we wish you a wonderful holiday and that everyone continues to be safe and well.
Yeah.
So also thank you, Alfonso and Gabriela. This was great to do this with you.
Yeah, it is.
Thank
And
you.
hopefully that everybody that's vaccinated get to go have Thanksgiving with their family, because I'm going to with my sister this year because we're all vaccinated. So we're all excited. And she just lives right up the road from me. So, you know, it was hard. It was a hard year when we couldn't see each other, you know. So now actually we're going to actually have Thanksgiving this year. So that's going to be cool.
Yeah.
So I hope everybody else does too. Just be safe, everybody.
Yes. Thank you.
Mhm.